Hi, my name's Neil Hamill. I'm born and raised in Kansas and did my medical training and residency at KU Medical Center. Went away to fellowship in Detroit and came back home and have been practicing in the state of Nebraska ever since. I'm a specialist in maternal fetal medicine, which means I see and treat mothers who have complicated pregnancy, either from medical complications or they have a baby with an issue that requires specialist attention. One of my areas of clinical interest is when there's abnormalities of the fetal heart. And so if you're seeing me for that indication, just know that we'll sit down, we'll draw pictures, we'll give you as much information as we can while we facilitate ongoing care with our partners, often at Children's, and here, ongoing care at University. I love the medicine side of pregnancy, diabetes, hypertension, and I love the technology side of pregnancy as well, which is ultrasound. We have two patients, mom and fetus, and ultrasound's our tool to physically examine the fetus. And those two, for me, are just a natural combination of where my interest and skills rest. Those first visits can be a lot for a patient to go through. Usually, we'll pair an ultrasound before the physician sits down. And when I sit down, my goal is to communicate as much information about your specific issue as we have. And I want to answer as many questions as we have at your level of understanding. So those visits are longer, and they're intentionally longer so that we can make sure you have the information that you need to make the best informed decisions about how to care best for you and your baby. I spent my first 15 years in Omaha in private practice and transitioned back to the academic environment so I could really be more present in the education of residents and students. And that's a real passion of mine.